All right, so the title of my research is The New Virtual Reality, a case study on the effect of teletherapy on individuals with aphasia. So for the introduction and literature review, aphasia is a serious neurogenic language disorder that can be especially difficult to treat depending on its type and cause. It causes communication disorders with expressing language, comprehending language, and sometimes both. There are at least 2 million individuals in the United States that suffer from aphasia today. Currently, there is not a significant evidence base for the effect of it on aphasia. However, the literature suggests that individuals with aphasia make progress during therapy when there's an element of routine, which is easily implemented with a virtual format. This format can take away any changes that might occur on the drive to therapy, changes with therapists, anything that would change routine that would make it more difficult for progress to continue to occur. So, within the article investigating the utility of teletherapy in individuals with primary progressive aphasia, the use of teletherapy showed significant progress with individuals with aphasia. Similarly, a study titled In-Home Synchronous Telespeech Therapy to Improve Functional Communication in Chronic Post-Stroke Aphasia results from a quasi-experimental study. The researchers discovered there was a strong positive correlation with progress in individuals with aphasia while using a virtual format. While these two studies and a few others indicate progress, there's a significant lack of studies and evidence for this potentially beneficial method of service delivery. Especially in the age of COVID-19, when nearly all previously in-person interactions have moved virtual, now is the time to investigate the benefits of this format for individuals with communication disorders. The routine that can be provided with the use of teletherapy could be extremely beneficial for these individuals. So the goal of this study is to gather data on and analyze previously completed works that look at the effect of teletherapy on aphasia, and to then implement these frameworks into a case study to investigate the effectiveness of these methods. This way, we can add to the lack of evidence about this topic. There are so few studies that have been done, and of those, many lack a standard of comparison to typically implemented therapy in person. For the methods of this experiment, it will be conducted as a case study. 2 separate clients, each with aphasia, will be the subjects. These subjects will be chosen based on a diagnosis of aphasia only, and the gender nor the type of aphasia will be factored. These clients will also be chosen based on the severity of the impact of the aphasia on their quality of life. 1 subject will be provided therapy via teletherapy, and 1 subject will be provided in-person therapy. This will be a randomized decision with who receives either service. The intervention strategies and activities will be the same so that the effect of the teletherapy will be measured rather than the type of treatment. A pre- and post-cognition and language test will be administered, as well as 2 different quality of life scales. This will track progress with the skills as well as the general outlook and quality of everyday life. The intervention strategy that will be used is gestural facilitation of naming. This strategy is aimed to improve an individual's skills in word retrieval through intact gesture abilities. This will then facilitate quicker activation of word retrieval through utilizing the interactive components of language and action. This method of intervention was chosen due to its ability to be administered in person and via teletherapy effectively, and do so the copious amounts of data giving it credibility. Each client will receive therapy twice per week for 30 minutes a session for one 12-week period that will end with a total of 24 sessions for each client. That will be 8 hours total of therapy for either client. The clinician will make goals that will be very similar between the 2 clients, if not identical. That way, the method of delivery will be what is examined rather than the type of therapy or the goals implemented. Progress will be tracked throughout the semester. Progress will also be measured in the pre- and post-test results. The results, conclusions, and future research portion of this poster are not yet completed. My references are at the bottom right, and thank you very much.